obtain testosterone in different ways. You can obtain it in a pellet form where the pellets are inserted under the manufacturer of the pellets will promote it as it provides a consistent level for 2 to 4 months, and that this pellet's going to be inserted and your body will just pull the hormone from that pellet as it needs it. The reality is we do not have the physiology to support that. We have seen this in our practice, and Dr. Nichols used testosterone pellets for 1 year. But unfortunately, what really happens with pellets is you put a pellet in someone, the level goes really high initially, and over the course of 2 to 4 months, the level declines. However, we have seen where the levels may decline for 2 or 3 months, and then they have a spike in testosterone and it goes just as high as it was when it was initially put in. So the problem with pellets is you can't control the dosage. If it's too much or too little, you just have to ride it out until your next insertion is due. You can also get testosterone in injections in an injectable form. However, you still get those peaks and troughs or the spikes and valleys that you can get with pellets. It's just a shorter duration of time. With pellets, it may last 2 to 4 months. With injections, closer to 2 to 4 to 7 days. Also, there are some adverse effects associated with injections, and one of those is that it can tax your liver, which really goes against what our long-term goal is, which is trying to protect and preserve the best quality of health for as long a period of time as you can. Our preferred method of delivery is testosterone cream. It is easy to apply. You don't have to inject. Over time, you can also develop scar tissue from injection sites. By doing the testosterone cream, you avoid that, and there is no ester attached to the cream. It's just 100% bioidentical testosterone compounded into an HRT-based cream, which is very hypoallergenic. It's non-irritating. It doesn't contain alcohol, and it's very easy to apply. So the cream is, in our opinion, by far the best method of delivery and the one that I choose for myself. Oral testosterone is also available. However, it has been shown to cause some issues with the liver as well. So there's not much use of that now.